Welcome back, dear seniors. Today we'll continue discussing the remaining points about blood test mistakes. And number 2 is going to be especially important, so stay with me till the end. Number 5. When your nerves sabotage your results. Let's talk about something that happens in your mind but shows up in your blood, the white coat effect. Most people think this just affects blood pressure readings, but it goes way deeper than that. A groundbreaking 2024 study from Harvard Medical School followed 2,000 patients and found something incredible. People with medical anxiety showed cortisol levels 45% higher than their baseline, blood sugar elevations averaging 18 points, and white blood cell counts up to 25% higher, all from stress alone. Even mild anxiety about getting stuck with a needle can trigger a stress response powerful enough to make you look like you have serious medical conditions. There's this one case that really stuck with me. A patient's blood sugar spiked to 142 during a stressful blood draw. That puts them in the pre-diabetic range. 2 days later, they retested in a calm state. Blood sugar? Completely normal, 95. Same person, no medication changes, just less stress. Here's what's happening physiologically. When you're stressed, your sympathetic nervous system kicks in. It floods your body with adrenaline and cortisol. Your liver dumps glucose into your bloodstream for quick energy. Your white blood cells mobilize like they're fighting an infection. Your inflammatory markers spike. Studies show that CRP, that's C-reactive protein, a key inflammation marker, can literally double within 30 minutes of acute stress. Your cholesterol can go up by 10% during a stressful blood draw. So, what's the solution? Arrive at least 15 minutes early for your appointment. Just sit. Decompress, breathe. Practice deep breathing exercises while you're waiting. Tell the phlebotomist if you're anxious. They deal with this all day, every day, and they can help you relax. Research shows that listening to calming music during blood draws reduces stress hormones by 23%. Bring headphones. Create a playlist. If you have severe medical anxiety, ask if you can lie down during the draw. This reduces something called vasovagal responses and the associated stress hormones. Some people benefit from scheduling their blood work first thing in the morning, when cortisol rhythms are more stable and you haven't had time to build up anticipatory anxiety all day. Number 4, the movement factor. That changes everything. This one is shocking because it seems so harmless. Movement and position changes affect your blood composition way more dramatically than most people expect. A study from the Journal of Clinical Pathology found that simply standing up from lying down for just 5 minutes increases protein levels by 10%, calcium by 6%, and cholesterol by 8%. The researchers tested 400 patients and discovered that people who had been walking around right before blood collection showed hematocrit levels averaging 5% higher than those who sat quietly for 15 minutes first. Why does this happen? Gravity. When you stand or move around, gravity causes fluid to shift from your blood vessels into the surrounding tissues. This concentrates the blood components that remain in your vessels. Even fidgeting during the blood draw itself affects results. Potassium levels can spike by up to 20% just from clenching and unclenching your fist. You know how they used to tell you to pump your fist during blood draws? They don't do that anymore because we now know it causes false elevations. A 2023 study documented cases where patients were prescribed heart medications for high potassium levels that were actually just artifacts from fist pumping during collection. Imagine being put on medication you don't need because you squeezed your hand. Even your arm position matters. Having your arm hanging down versus supported at heart level can change readings by significant amounts and affect blood component concentration by 3 to 5%. Here's what you need to do. Arrive early, 15 minutes minimum, and sit quietly. Keep your arm relaxed and supported at heart level during the draw. Don't pump your fist unless you're specifically asked, and even then, do it minimally. If you had to walk a long distance to the lab, factor in extra sitting time before collection. For the most accurate results, especially for protein and cell count tests, stay in the same position for at least 15 minutes before blood is drawn. Number 3. The arm selection mistake. Healthcare workers miss. This is something even many healthcare workers don't fully understand, and it can completely invalidate your results. The CDC did an investigation and found that up to 10% of abnormal blood test results in hospital settings were actually from contamination from IV fluids, not the patient's actual values. When you have an IV running, even if it's in a different vein in the same arm, the fluids can leak into surrounding tissues and get pulled into the blood sample. There's a documented case of a patient showing a glucose reading of 450, indicating severe diabetes, when their actual blood sugar was a normal 95. All because the blood was drawn from the same arm as their dextrose, AV. But it's not just about current IVS. If you've had a recent injection, vaccination, or contrast dye for imaging in one arm, that arm should be avoided for blood draws for at least 24 to 48 hours. A 2022 study found that blood drawn from recently vaccinated arms showed inflammatory markers up to 200% higher than the opposite arm. It could look like you have serious systemic inflammation when it's actually just a local reaction at the injection site. Even having your blood pressure taken repeatedly on one arm can temporarily change the blood composition in that limb through pressure changes and mild tissue trauma. The solution is simple but requires you to speak up. Always inform the phlebotomist about any recent procedures, injections, or IVs in either arm. They might not ask, so you need to volunteer this information. If you've had lymph nodes removed from one armpit, this is common after breast cancer treatment. That arm should never be used for blood draws because it can cause lymphedema. When possible, use your non-dominant arm for blood draws to minimize movement artifacts. If both arms have had recent procedures, ask about alternative sites or consider postponing the blood test until one arm has fully recovered. Number 2. The food factor that trips up 78% of people. All right, we're at number 2, and this is huge. Studies show 78% of people make this mistake, and it's absolutely destroying their blood test accuracy. Even when you're not required to fast, what you eat in the 24 hours before your test massively impacts your results. A landmark study from Stanford University in 2023 followed 1,500 patients. They found that eating fatty foods within 24 hours of blood tests increased triglyceride readings by an average of 25%, with some patients showing increases up to 40%. Here's what really shocked the researchers. High-fat meals can make your blood so lipemic, that means full of fat particles, that it actually interferes with the lab equipment's ability to analyze other components. Your blood gets cloudy. The machines can't read it properly. Imagine being diagnosed with high cholesterol, prescribed statins for the rest of your life, when the real problem was that you had pizza and ice cream the night before your test. But it's not just about fat. Eating red meat within 24 hours can spike your creatinine levels by up to 30%, making it look like you have kidney problems. There's a case study of a bodybuilder who ate 2 pounds of steak the night before his test. His kidney function markers suggested stage 2 kidney disease. They retested him after avoiding meat for 48 hours. His kidneys? Perfectly healthy. Sugar is another huge culprit. Consuming sugary foods or drinks within 12 hours of testing can elevate your fasting glucose by 15 to 20 points. That's enough to push you from normal into the pre-diabetic range. Even artificial sweeteners can trigger insulin responses that affect multiple blood markers. Coffee, even black coffee during a fast, can increase cortisol by 25% and affect liver enzymes. Here's your optimal approach. For 24 hours before testing, eat light, balanced meals with moderate amounts of lean protein, vegetables, and whole grains. Avoid fried foods, fatty meats, sugary treats, and alcohol completely. If you're getting cholesterol or triglyceride tests, Some experts actually recommend eating your typical diet for 2 weeks before testing to get accurate baseline results, then avoiding all high-fat foods for the final 24 hours. This gives you a true picture of your normal state, not an artificially low reading from eating perfectly for 2 weeks. Keep a food diary for the day before your test and bring it to your appointment. It can help your doctor interpret any unusual results. Number 1. The fasting failure that undermines everything. And here we are, number 1. This is the granddaddy of all blood test mistakes. Studies show up to 43% of people get this wrong in ways that completely invalidate their results. A massive 2024 analysis of over 1 million blood tests found that improper fasting was responsible for more misdiagnoses than all other preparation errors combined. The confusion starts with not understanding what fasting actually means. True fasting for blood work means absolutely nothing except plain water for the specified time period, usually 8 to 12 hours. But here's what people don't realize. Even tiny amounts of calories can ruin the test. That piece of gum you're chewing, it has 5 calories and sugar alcohols that can spike your glucose reading by 10 points. The cream in your coffee, even just a splash, has enough fat to elevate your triglycerides by 50 points or more. The Mayo Clinic tested 600 patients who claimed they fasted properly. When they questioned them in detail, 31% had consumed something they didn't think counted. Breath mints, flavored water, supplements, even some medications. There's a case that illustrates this perfectly. A patient's triglycerides measured 400. That indicates severe risk for pancreatitis, a potentially life-threatening condition. They were scared out of their minds. When retested after proper fasting, the number dropped to a completely normal 150. The only difference? They had been taking fish oil supplements during their fast the first time. But here's something most people don't know. The timing matters enormously too. Fasting for too long is just as problematic as not fasting long enough. After 16 hours of fasting, your body starts producing ketones and breaking down muscle for energy. This elevates certain markers and can make you appear diabetic or malnourished when you're neither. Your liver also starts dumping glucose after extended fasting, which paradoxically raises your blood sugar. The perfect fasting protocol? Stop all food and caloric beverages exactly 10 to 12 hours before your blood draw. Not 8 hours, not 16 hours. 10 to 12. Water is not only allowed, it's encouraged. You need it to maintain proper hydration. Schedule your test for early morning so you're sleeping through most of the fasting period. This makes it so much easier. If you take medications, ask your doctor whether to take them during the fast. Some should be continued, others should be held. There's no universal rule, and it depends on the medication and the test. Set an alarm on your phone for when to start fasting. Remove temptations from easy reach. Put that bag of chips in the back of the pantry, hide the cookies. And here's something critical. If you accidentally break your fast even with something tiny, reschedule your test. Don't hope it won't matter. It will matter. It absolutely will matter for accurate results. Taking control of your health story. Listen, these 10 mistakes aren't just minor inconveniences that slightly adjust your numbers by a point or two. They're the difference between accurate health information and potentially life-altering misdiagnosis. They're the difference between taking medication you don't need and getting the treatment you actually do need. But here's the most empowering part of all this. Every single one of these mistakes is completely within your control to avoid. You don't need special equipment. You don't need medical training. You just need the awareness you now have and the commitment to follow through. Your blood tests are snapshots of your health. They guide crucial medical decisions. Decisions about medications, procedures, lifestyle changes. You want to make sure those snapshots are showing the real picture, not a distorted version created by preventable preparation mistakes. The next time you're scheduled for blood work, I want you to come back to this video. Review this list. Give yourself a checklist. Check off each item as you prepare. Give yourself the gift of accurate results. Your future health decisions literally depend on getting this right. Now, I want to hear from you, and I'm genuinely curious about this. Have you ever gotten scary blood test results that turned out to be nothing? Which of these 10 mistakes have you been making? I read every comment and I learn from your experiences. They help me create better content for this community. Drop a comment below sharing your story, and if you found this valuable, share it with someone who needs to see it. Your mom, your dad, your friends who are dealing with confusing test results. This information could save someone from unnecessary worry or help catch a real problem that's being masked by these mistakes. Thanks for being here.